Whether you are traveling or staying here this holiday weekend, doctors are asking everyone to stay safe as the COVID-19 pandemic continues. That might mean enjoying your Labor Day in a different way this year. And joining us now with advice on how to stay safe is Memorial Hospital's ER Medical Director, Dr. Fred Jenkins. Doctor, thank you for being with us this morning.
Thank you for having me.
And first and foremost, as people travel this weekend, what precautions should they take?
Well, first of all, any travel carries with it the risk of either acquiring or spreading COVID. So that's why, I guess staycations are so popular this year. There are several things that you can do to help mitigate this risk. First of all, never travel if you're sick, particularly if you have upper respiratory symptoms of fever, cough, sore throat. Don't travel with anybody else who's sick. And if you've been exposed to COVID-19, exposed to somebody who has COVID-19 within the past 14 days, consider not traveling as well. You'll want to vet the hotel that you're staying at for its COVID-19 practices. You'll want to make sure that the staff wears masks, that they clean the common areas frequently. The remotes and other high-touch surfaces have those disposable covers. Apart from that, it's the same thing that you want to do here. Socially distance to 6 feet, wash your hands frequently, wear a mask in public, don't touch your face or mouth.
And are there any certain locations or places that people should avoid?
Well, you'll want to find out and research the COVID-19 activity at the destination that you're thinking about traveling to. And this is really easy to do. The Centers for Disease Control and Prevention have a COVID-19 tracker, and you can quickly find the number of new COVID cases at any state in the United States just by using it. And there's also information on international destinations as well. It's a good idea to find out if there's any, special travel restrictions or quarantines or other things that might sort of limit your travel. A good resource for this would be the Department of Health website for the state that you're looking at traveling to. And for international travel, the Department of State's website is a great resource for this.
And you mentioned that people should do things like social distancing and wear masks. But if people are flying or driving, are there any extra things that they should pack?
Well, a mask or several, certainly. It's a good idea to pack hand sanitizer that has a minimum of 60% alcohol. I think it's a good idea to take sanitary wipes for high contact surfaces. So an example of this would be if you're the handle on a gasoline hose when you stop to fill up. I mean, think of how many people have touched that. It's a good idea to pack food and water. You might find that when you get to your destination that the grocery stores and restaurants are operating under severely restricted hours. It's a good idea to take an extended amount of your medication, in case your return trip home gets delayed.
And in addition to going to the beach, this weekend is a really popular time for barbecues. What do you recommend for people or families who are staying home? They're not going out, but they are having gatherings at their home. Well,
sort of a rule of thumb is that you want to resist going into large crowds or enclosed public spaces. You got to think about it. Anytime you go into a building where there's a lot of people in it, there's going to be a risk of catching COVID. And so you want to make sure that when you do this, that there's efforts in place to mitigate this. And this would include enforced social distancing, where seating is well spaced out and that the occupancy is limited, that there's frequent cleanings that occur, that masking is enforced both by staff and by patrons. And, you want to consider the amount of time that you're going to be in the building. I mean, if you're going to go watch a movie, that's kind of a lot of time. As far as, being outdoors at a barbecue, it's probably safer to be outdoors because it's easier to socially distance, and you don't have the whole issue of recirculating air, but you still have to socially distance. And if you're going to be in a really crowded area, it's a good idea to wear a mask.
And if someone in your group, in your family, starts to feel sick or just doesn't feel themselves, what is the best thing for them to do in that situation?
Well, it depends. So if the symptoms are severe, and there are severe symptoms of severe COVID-19 disease, and this would include shortness of breath, chest pain, confusion, lethargy, feeling faint, then you want to go to the emergency department. Now, fortunately, most COVID-19 illness is not that severe. So, the principles of management are isolation. You want to avoid contact contact with other people as much as possible. Stay inside, wear a mask, and again, isolate. Take Tylenol, drink lots of fluids.
Dr. Fred Jenkins, thank you so much for being with us this morning.
Thank you. Have a good weekend.